My name is Junaid Hussain and I work for the Equality and Inclusion Partnership. We're based over in the Warwickshire area, and we've been operating for the past several years in terms of promoting equality, promoting diversity and inclusion across 9 protected characteristics as defined by equality legislation. The aim of the project was to increase the competencies and the capacities of health professionals and health institutions in meeting the diverse cultural needs of patient groups. Some of the areas that we explore through the projects in terms of cultural differences and really in picking them, it starts with that individual at the very beginning, rather than it just being seen as somebody with a different culture trying to access a healthcare service. It's about, well, actually, how can that health practitioner be sensitive enough to understand some of the issues surrounding those cultural differences, and what would they potentially adapt to make it more of a positive experience. I think the common thread that brought all the organisations together was the kind of inquisitive nature of looking into culture and cultural awareness that each of the organisations had, but also as well the element of inclusion and looking at inclusion from a health perspective. Within the UK, discrimination is very clear cut and it crosses different protected elements, whereas in certain countries those protected elements aren't really recognised as protected groups. So yes, by all means it did have a variation from country to country. However, we were able to really bring our thinking together in looking at a more of a holistic approach in terms of discrimination. Also as well, many of the European partners, they looked to the UK as an example of effective practice and really kind of commended and valued the work that's taking place. However, at the same time, being from the UK, looking at some of the practices across the EU countries and across the EU partner countries, they were doing some fantastic work as well. One thing that I and my colleagues picked up was complex is not always better, and the more simple the approach, the more effective the approach as well. And that's something that we picked up in terms of some of the methods that they were using to engage and have these kind of difficult conversations about within the context of health, looking specifically at health, looking specifically at culture as well. So the simple approaches were perhaps the more effective. That's one of the things that I picked up from some of our partners. I would say it has had a huge reach, because the networks and the partnerships that each of the respective partner organisations have is absolutely huge. And I mentioned earlier about the various disciplines that each of the partner organisations come from, in terms of academia, in terms of frontline community-based organisations, in terms of frontline health service providers as well. So you can imagine that the reach has been far-fetching. It would be amazing to see some form of continuation of those relationships to a large degree. I think the work that Erasmus Plus, the program of Erasmus Plus and the work that goes behind it has been absolutely amazing in terms of the opportunities that it's provided, not just to participants but to organisations as well, whether those organisations are from the public, the third sectors, and so on and so forth. This particular Healthy Diversity was the first one where we were with a coordinating organisation, and yeah, it was a great experience. It really was a great experience for us. You know, this particular project was a game changer in terms of shaping our thinking as an organisation, but also in terms of the work that we do as well. So, you know, I really do take my hat off to the whole programme.